whatever we have in our cupboards. I want to emphasize quality, and I have this conversation with many patients. Really and truly, the more you can do to elevate the quality of the food you have, the better you will be. And I am talking about as much organic, free range, grass-fed, local things as you can bring into your diet. And I was checking this before I came out to see what the evidence was in terms of eating things that are organic. And I know there have been studies. I couldn't find a study on the quality of the food. And there are many who actually want to say that, no, it doesn't matter if you eat organic, not organic. But let me give you a corollary, and I deal with this with people all the time. We have something called toxic burden in the body. And there have been studies done on the level of our pesticides, toxic metals, other exposures. I've heard Dr. Wright say this many times. Even the penguins in Antarctica have pesticide residues. It's estimated that somewhere between 80 and 90 toxic metals, minerals, what have you, are present in every one of us, including our children. So, regardless of the argument about organic, not organic, what I have seen in terms of health, and this is relevant to weight loss, is that the minute somebody has something happen, it could be a virus, it could be an exposure. I just had somebody who I believe had exposure to some additional mercury, and that mercury then sent him into the state of hearing loss. Don't know for sure, it's just a speculation, but he was a person who ate high levels of fish in his past. And if we have toxic metals, they don't go away, not unless we chelate them or find a way to remove them. So he's now experiencing a very devastating hearing loss, one-sided. So what happened, his body was able to process this, keep him well until he had this additional exposure, and that sent him into a problem. I see this with organ systems all the time. And so I have one 31-year-old Japanese patient developed a cataract. That's very early. Cataract surgery at that age is very risky. So what we're talking about when I'm talking about organic, free-range, grass-fed, the cleanest diet you can get, we're talking about preventing problems down the road. Now, I realize the costs are a factor, but I ask everybody, factor in the cost now versus the cost later. And end-of-life care, those types of things we go into, the most money we ever spend is spent in probably the last decade of life. So ask yourself, how well do you want to be? What is the best diet you can afford? It really makes a difference. Yes, sir.
So what's your opinion about mercury fillings, teeth fillings?
You're not a dentist, are you? Many people here actually have them removed. And I have had patients who've had them removed, and they were removed about a decade ago before a lot of preparations or things were known about controlling the mercury vapor. And many people actually can date that timing with getting sick. I've experienced it myself, just in a minimal way. So it all depends on how much you're able to spend, what you need to do if you have mercury amalgam fillings. But it's a good idea to minimize the risk. I don't have, I know there are contrary positions from the dentists. I've looked at the different websites. Many of them are actually going toward removing, or not using mercury fillings. It depends. Yes, ma'am. I don't know what the replacements are. Would they be porcelain, veneers? Yeah, that type of thing. Yeah, there is even controversy about the types of metals, from the silver, different types of metals that are used. What we do here, and Ruth, maybe you can verify, do you do testing for the metals that are okay to put into into a filling for a patient? Do you test sensitivity? Okay. What I'm referring to is that we do some bioenergy testing here that looks at the compatibility, whether you might be allergic to them. Different physiologies respond differently depending. So it's an individual question, how bothered you are, how sick you are, what you're able to afford. It's not inexpensive. And if you do choose to have them removed, you want to have as high a quality of a detoxification protocol that you can get. Make sure your dentist is familiar with the protocols, does use the dental dams and good circulation, that type of thing, because the worst exposure to the mercury is when it's vaporized. So in some sense, leaving it there, then we go to disturb it, we start to stimulate it in the body. But toxic metals don't go away. They literally stay there until perhaps they cause a problem. And I spoke of this earlier, but we do see people who have chelation done to reduce their metals, improve it in terms of cardiovascular health, other sorts of health issues. I'm sorry, I digress, but it's a topic I feel strongly about. Yes, ma'am.
What about mercury that's in like immunization? There's not really a way to detox out of that.
That's not, I know the arguments. I don't feel competent right now about talking about it because we're talking about implications for autism and other health issues. That would probably be a digression, but it may be a good topic to bring into future talks about exposures. And I know there are both discussions on both sides of the fence. I know the doctor who originally brought this up is now facing some challenges. I don't know the whole story on that, but it's complicated. And one of the things I think everyone needs to do, and that's why you're here, is become your own best advocate. Understand the issues, how you can impact your health and the health of your families and then their families. Yes, sir. Yes.
What does Prilosec, does that lower the acidity or?
Yeah. Let me just say that many of the things like Prilosec and the proton pump inhibitors are given because there's an assumption that the acid is too high, not that it's too low. And so what they're attempting to do is prevent the acid. And so I can't evaluate whether all of those circumstances are based on high or low acid, but what I can tell you is when I see people who've been on some of the earlier generation things, early Prilosec, let's say for 20 years, many come in with incredible osteoporosis, malabsorption of nutrients. What it does when you lower the stomach acid, you can't absorb many things, including iron, calcium, things that require an acid to break it down for absorption. So that's why I advocate testing if you're concerned, to see, because there can be many other health issues. I see people who seem to have pernicious anemia, for example. They can't absorb. They show an anemia. Low B12 folic acid can be a factor there. A low intrinsic factor. So there are many different things that we mess with when we start to mess with the stomach acid. And so, again, there may be times when it's appropriate, but most of the time, I haven't seen that. Other questions on that? We kind of get off the topic, but what I'm saying is use as clean a diet as you can. Go home and clean the pantry of certain things that you would not judge as high quality. I know you'll be worried about the cost there, but maybe find ways to use it. But use the best quality food that you can and limit anti-nutrients, the poor fats, sugar, refined, great use of dairy. I have mixed feelings about dairy. And then meats. I'm for eating, meats. I used to be a vegetarian, I'm not now. But eating meat in the right way is what's important. And we do advocate grass-fed. I know corn-fed tastes wonderful, but it also increases the bacterial count. And I hope none of you work for the meat council or whatever. Don't want to be like Oprah, but find myself on the other side of one of those. But what I will say is that even if it's corn-fed, if it's grass-fed toward the end, it actually clears those out. So, and there are ways to find grass-fed meats palatable, the way you mix them and use them. So awareness is very important, knowing what we're doing, why we're doing it. And you've all probably heard this, digestion begins in the mind. We think about food, maybe we smell food, and we create this imagery of the food, what we want to experience. It stimulates the brain, what we call the cephalic phase of digestion. So what I want to encourage you to do after you leave tonight and ongoing, think about what you want food to do for you. What do you really hope? I mean, do you want to just experience something to get you by because you have low blood sugar, or how do you want to experience the food later on? Set the intention for your eating. This is actually the key to dietary success. It's not willpower, it's not pushing things away. What's your actual intention? And I know every one of you have done this in one way or another, whether it was going to school, having a family, starting a business. Every one of you have done that. And what I'm advocating is do that with how you eat. This is not just a diet. This is a lifestyle plan. And I want to get to this point because this one is actually key to the slow down diet. So, rhythm.